This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the journal Neurologia medico-chirurgica titled Outcomes of Postnatal Myelomeningocele Repair in a Japanese Single-Center Cohort, a comparison with the Management of Myelomeningocele Study trial.
This is a timely paper, Ilara. For our residents and colleagues listening, we all know the MOMS trial. The Management of Myelomeningocele Study changed the landscape of fetal surgery globally, but the context in Japan is unique because fetal surgery for myelomeningocele is not yet standard practice there.
Exactly. The researchers at this major Japanese center wanted to establish a baseline. If you're going to introduce fetal surgery, you first need to know exactly how your current postnatal care performs against international benchmarks. They looked at a retrospective cohort of 65 patients who underwent postnatal repair between 2002 and 2021.
20 years of data is a solid foundation. Let's talk about the patient characteristics first. How did the lesion levels in this Japanese cohort compare to what we usually see?
It was a diverse group. About 18% of the patients had thoracic lesions, 12% were at L1, L2, and the majority, 69%, were at L3 or below. This distribution is vital because lesion level is such a strong predictor of functional outcomes, particularly ambulation.
Right. And the study focused on two primary endpoints that the MOMS trial highlighted: the rate of cerebrospinal fluid shunt placement at 12 months and ambulation status at 30 months. What did the data show?
This is where it gets interesting. When they compared their results to the MOMS postnatal group, the numbers were remarkably consistent. The shunt placement rate in the Japanese cohort was 88%, compared to 83% in the MOMS postnatal group. The p-value was 0.39, so there's no statistically significant difference there.
And what about ambulation? That's often the biggest concern for parents during prenatal counseling.
At 30 months, the ambulation rate in this cohort was 28%, while the MOMS postnatal group was 20%. Again, with a p-value of 0.29, it wasn't a statistically significant difference. This suggests that the standard of postnatal care at this center is very much in line with the international benchmark set by the MOMS trial.
That's reassuring for the baseline. However, the study did find some significant deviations in secondary outcomes, didn't it?
It did, and some were quite striking. First, the good news. The rate of shunt infection in the Japanese cohort was 0%.
0? That's impressive compared to the 9% reported in the MOMS trial.
It really is. A p-value of 0.02 confirms that's a significant difference. However, on the other side of the ledger, they found significantly higher rates of surgical intervention for Chiari II malformation and tethered cord syndrome.
Let's dive deeper into those numbers. What were the specific rates for symptomatic Chiari II?
In this cohort, 18% of patients required surgery for symptomatic Chiari II malformation, compared to only 5% in the MOMS postnatal group. That's a significant jump, with a p-value of 0.01. Similarly, surgery for tethered cord syndrome was performed in 9% of their patients versus only 1% in the MOMS group.
That's a nearly tenfold difference in tethered cord surgery. As a senior attending, I find those surgical rates particularly interesting. It raises questions about whether these differences are due to pathophysiology or perhaps a more proactive surgical philosophy at this specific center regarding symptomatic management.
The paper notes these as significant findings that differ from the international benchmark. But the core takeaway remains. The survival and major functional milestones, like shunting and walking, are largely consistent.
Why is this paper so important for the Japanese neurosurgical community right now?
Because as fetal surgery is introduced in Japan, clinicians need this indispensable baseline, as the authors put it. When a family is diagnosed with a fetal myelomeningocele, the surgeon needs to be able to say, here is what we achieve with our current postnatal standards. It allows for an objective evaluation of fetal surgery's efficacy and risks within their own healthcare environment.
It's about grounded counseling. You can't just point to a trial conducted in the US and assume your local postnatal results are identical. This study proves that while the major outcomes match, the local nuances, like lower infection rates but higher revision rates for Chiari and tethering, are part of the local clinical reality.
Exactly. It provides the data necessary for truly informed consent.
Excellent summary, Dr. Ilara. For our residents, remember that standard of care is often defined by these large-scale trials, but local validation studies like this one from Neurologia medico-chirurgica are what actually guide our daily practice and patient counseling.
Thanks for joining us on the Neurosurgery Hub podcast. We'll see you in the next episode.
Until next time.